Kids Thrive Therapy is a pediatric occupational therapy clinic located in Towson, Maryland. With over 10 therapists, our holistic and client-centered team focuses on providing exceptional care. A few of our licensed therapists have further training and certifications to treat infants. All of our therapists provide holistic and child-centered evaluations and treatments. Our baby specialists work with infants and their families as young as days old. For children this young, their occupation, what gives meaning to their life, is simple: eating, playing, and sleeping. These are the skills that we work on. People often are unsure when it is appropriate for bringing a baby to OT. Our goal is to use this video to give you some more background, and if your baby is having trouble with feeding or comforting their body, OT could be a great fit. When an infant comes for an evaluation, we treat them holistically, looking at the entire child. We begin our session with assessing and treating the full body. We are looking for tension throughout the body, including stiffness, positioning, and asymmetry, as well as uneven or insufficient muscle strength. Targeted body symmetry includes eyes and ears looking symmetric, symmetry of movement of the limbs and the right and left side, symmetric or even ability to rotate the head between right and left shoulders, symmetric strength and movement of the oral motor muscles, including the jaw, lips, cheek, and tongue, symmetric muscle use, including reaching and rolling in both directions, and the commonly known diagnosis of torticollis and plagiocephaly, or head flattening. An asymmetry of any type often occurs due to muscle tightness or weakness. Our therapists work with caregivers to learn environmental modifications, exercises, and play positions to support full body symmetry. Additionally, if a baby is not meeting their motor milestones, our therapists are trained to tease out the reason behind this, as these milestones are innate and should be achievable within the infant stage. After identifying the cause, therapists work with families to promote acquisition of motor milestones, including rolling, sitting, and crawling. Again, with emphasis on releasing tension, promoting symmetry, and building strength, we find success with each of our infants in reaching their milestones. Our goal is to help the baby be as comfortable in their body, which in turn allows for free and developmentally necessary movement and exploration. In addition to looking at the body for symmetry and strength, our therapists evaluate infants for oral motor skills, including strength and symmetry. Our oral motor evaluation is completed to support whichever form of feeding the family is currently using, including breast, bottle, and transitioning to solids. For each of these types of feeding, there are numerous oral motor muscles which need to be both strong and coordinated for feeding to be effective. Our therapists have extensive training in supporting oral motor development throughout both bodywork and oral exercises and stretches. We also support optimal oral motor function through providing pre- and post-care for tongue and lip tie releases. This care is vital in retraining the muscles and supporting full function of these small but incredibly vital structures. Our therapists support optimum outcomes for releases through motor and sensory skills, promoting a positive association is kept with the mouth the entire time. In our older babies, this positive oral experience is pivotal in transitioning to solids, in which we use our understanding of multisensory processing, strength, coordination, and oral motor skills to support the transition. Sensory processing is assessed and supported throughout our infant OT, as the sensory system is very active and impacted during the birth process. Our therapists work with caregivers to use sensory modalities to support regulation within themselves and their baby. This directly impacts all of the important parts of life: play, sleep, and feeding. Most often, infants and babies are seen in our clinic on a weekly or bi-weekly basis. This allows for our therapists to foster a teaching relationship with families and empower them to support their baby's development. Our therapists believe strongly in the collaboration with other providers on the baby's care team to promote optimal outcomes. Families will consistently work with the same OT and will be given homework at the conclusion of each session. The therapist provides caregivers with education and activities to continue to make progress toward their goals, including oral motor work, feeding supports, body strengthening, and stretching. Thank you for taking the time to view our video and learn more about the resources within the community to support your child. If you are interested in learning more about occupational therapy for your infant or toddler, please feel free to reach out. We wish you the best of luck on this exciting journey.